Dr. Compton here, hands of the surgeon, I have an artist. Just wanted to go through a few facelift incision variations and just talk about sort of what my decisions generally are. So let's just dive right into it. So for the brow lift, generally we're looking at an incision in this area right here in the temple, behind the hairline. Most of the time for this, for the upper incision, we'll put that right at the hairline. Around the hair here, we're gonna wanna preserve this called the temporal tuft. So we'll look at something like that. This can be extended up into the hairline. This will come all the way back to this area called the root of the helix. Down the root of the helix. Then we'll go behind the tragus. So it's really on top of the tragus. It's not really behind it, but it's called a retrotragal. There's also a variation which you'll go in front of the tragus, so that's another option. More popular in men, but there's definitely certain patients who would benefit from doing a pretragal incision. We'll come out here and come down right in front of that earlobe. That was a little bit off the earlobe. Right there is the earlobe. Okay. We'll go behind that, up on the back part of the ear. Then where the ear kind of meets the hairline, you can kind of play with it a little bit. That's where you want your incision to be. Now I like to just gently transition there. Sometimes if you make that too sharp, that area can die, and we don't want to deal with a wound complication or a poor healing area. That also scar won't look good. So just a gentle transition. Then you come down this hairline here, just a little bit inside of it or just right at the edge. And you can take it down as far as you need to. The further down you go, the more neck skin you can take out. So most of the time it's not that long, but I was just demonstrating it. Now, as far as the neck incision will be right under here. That hides right in this crease here, and will be not visible really at all. So that's the basics of the incision. They're all planned in ways in which to hide them. Generally want the hair as it grows to sort of fold over the incision so that it's kind of up under the hair, and even grow through the incision in some places. We want the incision to be as invisible as possible, and sharp angles through here will help hide it. You know, contouring the anatomy helps hide it as well. So there's a bunch of little tips and tricks there, but that's the basics of the incision. So we really don't want anything too visible. So, all right, great. Hands of a surgeon, I have an artist. This is Dr. Compton signing off. Thanks.